Question 1. A new mother, Mrs. Carter, has been breastfeeding her newborn for a few days. However, she is concerned because her baby seems to feed frequently, even every hour, and often pulls off the breast, crying. Mrs. Carter is unsure if her milk supply is enough. What should you recommend as a first step in assessing her breastfeeding situation? A. Advise her to supplement with formula until the baby is more satisfied. B. Suggest the use of the breast pump to check milk supply and ensure the baby is feeding effectively. C. Recommend she monitor the baby's weight gain and diaper output before seeking further assistance. D. Encourage Mrs. Carter to offer both breasts at each feeding to increase milk production. Answer. C. Recommend she monitor the baby's weight gain and diaper output before seeking further assistance. Explanation. Frequent feeding and pulling off the breast could indicate a number of issues, including latch problems, ineffective milk transfer, or overactive letdown. However, before jumping to the conclusion that milk supply is insufficient, it's important to assess the baby's overall growth and hydration. Weight gain is a reliable indicator of whether baby is getting enough milk, as well as diaper output, at least 6 wet diapers a day. Counselors should prioritize monitoring these key indicators before recommending any further intervention like formula supplementation or pumping. Suggesting immediate supplementation with formula or other interventions could undermine breastfeeding and should only be considered if there's clear evidence of insufficient intake. Encouraging the use of both breasts during each feed potentially help increase milk transfer but isn't the first step in assessment. Question 2. Which of the following is not a recommended strategy for managing low milk supply in breastfeeding mothers? A. Offer both breasts during each feeding session to ensure the baby empties each breast. B. Advise the use of galactagogues, herbal supplements or medications to stimulate milk production. C. Encourage longer, more frequent nursing sessions, especially during the night, to increase prolactin levels. D. Suggest supplementing with formula to ensure the baby receives enough nutrition and alleviate stress. Answer. D. Suggests supplementing with formula to ensure the baby receives enough nutrition and alleviate stress. Explanation. While formula supplementation might seem like an easy solution to a mother concerned about milk supply, it is not a recommended first-line strategy unless there is clear evidence that the infant is not receiving adequate nutrition, e.g. poor weight gain, dehydration. Supplementing with formula may reduce the baby's demand. Breast milk potentially signaling to the body to produce even less milk. More effective approach to managing low milk supply includes techniques that encourage increased demand for milk, such as frequent nursing, offering both breasts at each session, and using galactagogues, which may help stimulate milk production. Additionally, offering more frequent nursing sessions, particularly during the night, can help elevate prolactin levels, which are critical. Milk synthesis. Question 3, scenario-based. Mr. Davis is a new father and has concerns about his wife's breastfeeding difficulties. His wife, Emily, is breastfeeding their second child. Emily has noticed some discomfort during feedings and the baby seems to be having trouble latching, often pulling away from the breast after only a few minutes. Emily is also worried that the baby isn't getting enough milk and is only producing a small amount of milk each time. What should be the first step in addressing these concerns? A. Recommend Emily to stop breastfeeding temporarily and pump to ensure she's producing enough milk. B. Instruct Emily to try using nipple shield to improve latch and reduce discomfort. C. Advise Mr. Davis and Emily to monitor the baby's weight gain and output of wet diapers over the next few days to assess the effectiveness of breastfeeding. D. Suggest that Emily should start supplementing with formula immediately to ensure the baby is receiving nutrition. Answer. C. Advise Mr. Davis and Emily to monitor the baby's weight gain and output of wet diapers over the next few days to assess the effectiveness of breastfeeding. Explanation. The first step in addressing Emily's concerns should be to assess the baby's overall intake and hydration status. Weight gain and diaper output are the most reliable indicators of whether the baby is feeding effectively. Pulling away from the breast and discomfort could be signs of latching. But this does not necessarily mean that Emily's milk supply is insufficient. Monitoring these indicators can help determine if there's need for further intervention. If the baby's growth and hydration are adequate, latch techniques and positioning can be further explored to address the discomfort. If the baby is not gaining weight or producing enough wet diapers, additional support such as pumping or even supplementation may be considered. However, these steps should be after assessing the baby's weight and hydration status. Question 4. Mrs. Thompson has been exclusively breastfeeding her newborn for 2 weeks. She is concerned that her baby isn't getting enough milk because the baby seems to be nursing every hour during the day and has started to cry after feedings. Mrs. Thompson is also worried that her breasts don't feel as full as they did in the early days. What should be your first course of action in helping Mrs. Thompson address her concerns? A. Suggest that she start supplementing with formula to ensure her baby is receiving enough nutrition. B. Recommend that she monitor the baby's weight gain and diaper output over the next few days to assess milk intake. C. Advise her to increase the frequency of breastfeeding sessions to encourage milk production. D. Suggest that she pump after each feeding to stimulate more milk production. Answer. B. Recommend that she monitor the baby's weight gain and diaper output over the next few days to assess milk intake. Explanation. It is common for mothers to feel that their milk supply is insufficient, especially in the early weeks when their breasts may feel less full and the baby may cluster feed, nurse frequently. However, these changes are often normal as the body adjusts to the baby's needs. The best approach in this scenario is to assess the baby's growth hydration status by monitoring weight gain and diaper output, at least 6 wet diapers per day. If the baby's weight gain and hydration are adequate, it would be a sign that the baby is receiving enough milk. Supplementing with formula or pumping immediately is not necessary unless there is clear evidence of insufficient intake. Increasing breastfeeding frequency is always helpful for stimulating milk production, but should be paired with monitoring infant health indic. Question 5. A mother MS. Parker is breastfeeding her newborn and has noticed that she is experiencing significant nipple pain and redness, especially after feedings. She has been treating it with lanolin, but the pain persists. Upon closer inspection, you observe a white spot at the tip of her nipple, and she mentions that her baby has developed thrush. What is the most appropriate course of action for MS? Parker's breastfeeding challenges. A. Suggest that MS. Parker continue using lanolin and wait for the pain to subside as the baby adjusts to breastfeeding. B. Recommend MS. Parker to discontinue breastfeeding temporarily and express milk with breast pump. C. Advise MS. Parker to seek treatment for both her and her baby's thrush to prevent further complications. D. Recommend the MS. Parker use nipple shields during feedings to reduce the pain. Answer. C. Advise MS. Parker to seek treatment for both her and her baby's thrush to prevent further complications. Explanation. The presence of nipple pain, redness, and a white spot at the tip of the nipple, combined with the baby developing thrush, suggests that MS. Parker may be experiencing nipple thrush fungal infection. This condition requires treatment for both the mother and the baby to prevent further complications and ensure successful breastfeeding. Treating the thrush with antifungal medications for both the mother, such as topical treatments or oral medications, and the baby, such as oral antifungal solutions, is necessary to resolve the infection. Continuing to breastfeed without treating the thrush could cause persistent pain and transfer the infection back and forth. Lanolin can help with general nipple care but will not treat the underlying infection. Using nipple shields could provide temporary relief. Should not be considered primary intervention for thrush. Question 6. Mr. and Mrs. Hall have recently adopted a newborn and wish to begin breastfeeding. The baby was born prematurely and is in the neonatal intensive care unit NICU. Mrs. Hall is eager to establish breastfeeding, but the baby is not yet strong enough to latch onto the breast. What initial steps should Mrs. Hall take to begin establishing milk production and preparing for eventual breastfeeding? A. Begin pumping breast milk regularly to establish supply and store milk for future feedings. B. Encourage frequent skin-to-skin contact with the baby to stimulate milk production and support bonding. C. Start supplementing with formula to ensure that the baby is getting enough nutrition until breastfeeding is established. D. Wait until the baby is discharged from the NICU before attempting to establish a breastfeeding routine. Answer. B. Encourage frequent skin-to-skin contact with the baby to stimulate milk production and support bonding. Explanation. For mothers of premature infants, establishing milk production early is crucial even if direct breastfeeding is not immediately possible. Skin-to-skin contact, also known as kangaroo care, is a highly effective method for stimulating prolactin levels and encouraging milk production. This physical closeness helps with establishment of breastfeeding and also fosters emotional bonding, which is important for both the mother and the baby. Pumping regularly can help establish a milk supply, but skin-to-skin contact is considered the most beneficial initial step. It is important to wait for the baby to reach a stable condition before attempting to latch, but skin-to-skin can still begin right away. Formula supplementation should be a secondary consideration, and waiting discharge is not recommended as a first step. Question 7. Samantha is breastfeeding her 3-month-old baby. She is concerned about her milk supply because she is returning to work next week and needs to begin expressing milk for bottle feeds. She has heard mixed opinions about breast pump use. What should Samantha know about the best practices for using a breast pump to ensure she maintains an adequate milk supply? A. Samantha should pump only once a day to maintain her milk supply and avoid overstimulation. B. It is best to pump immediately before breastfeeding to avoid engorgement and maximize milk extraction. C. Samantha should pump regularly and frequently to mimic the baby's feeding pattern to maintain milk supply. D. Pumping excessively can lead to reduction in milk supply due to overstimulation of the breasts. Answer: C. Samantha should pump regularly and frequently to mimic the baby's feeding pattern to maintain milk supply. Explanation: pumping regularly and frequently, especially when returning to work, helps to maintain milk supply by mimicking the baby's natural feeding pattern. Ideally, Samantha should pump about as often as her baby would be breastfeeding during the day to ensure continued milk production. Pumping immediately before breastfeeding is not recommended as it may interfere with milk letdown when the baby tries to nurse. While it is true that overpumping could cause some issues such as engorgement, the primary concern for maintaining milk supply is pumping consistently to meet the baby's demand. As long as Samantha is careful not to overpump, she can maintain strong milk supply even while working. Question 8, MS. Garcia is a new mother and is having trouble with her baby's latch during breastfeeding. Her baby is showing signs of nipple confusion as they refuse the breast and prefer bottle. What would be the most effective strategy to address nipple confusion and encourage the baby to latch properly? A. Suggest that MS. Garcia switched to exclusively pumping to avoid further issues with nipple confusion. B. Recommend delaying breastfeeding until the baby is older and more capable of latching effectively. C. Encourage MS. Garcia to exclusively breastfeed for the next few weeks, avoiding bottle use completely. D. Advise MS. Garcia to use paste bottle feeding technique to reduce the chances of nipple confusion while reintroducing breastfeeding. Correct answer: D. Advise MS. Garcia to use a paste bottle feeding technique to reduce the chances of nipple confusion while reintroducing breastfeeding. Explanation: nipple confusion occurs when a baby has difficulty switching between the breast and the bottle because the sucking mechanisms differ. To reduce this confusion, using a paste bottle feeding technique is effective. This technique mimics the flow of breast milk by allowing the baby to suck in a natural way and helps maintain breastfeeding readiness. Exclusively pumping, option A, can reduce breast milk stimulation and make it harder to re-establish breastfeeding. Delaying breastfeeding, option B, or avoiding the bottle entirely, option C, are not recommended as they could prevent the baby from getting used to both methods. The best approach is to reintroduce breastfeeding with a slower transition and the use of paced bottle feeding. Question 9. Mr. and Mrs. Jensen have a 2-week-old infant who was born via cesarean section. Mrs. Jensen has had difficulty with breastfeeding due to painful nipple trauma and feels overwhelmed by the demands of newborn care. She expresses interest in receiving additional support from a lactation counselor. What should be the first step in providing Mrs. Jensen with the help she needs? A. Suggest that she switch to formula feeding to reduce stress and discomfort. B. Recommend that Mrs. Jensen try using nipple shields to alleviate the pain and improve the latch. C. Advise Mrs. Jensen to consult a lactation consultant for an in-depth assessment of her latch and positioning. D. Encourage Mrs. Jensen to stop breastfeeding temporarily and focus on recovering from her cesarean section. Answer: C. Advise Mrs. Jensen to consult a lactation consultant for an in-depth assessment of her latch and positioning. Explanation: in this scenario, it is crucial to assess the baby's latch and positioning during breastfeeding, as nipple trauma is often caused by improper latch. Lactation consultant is the best resource to evaluate these factors and provide specific guidance on improving the latch and positioning to reduce pain and improve milk transfer. Option B might help alleviate pain temporarily, but they should not be used as the first line of treatment without professional guidance. Switching to formula feeding, option A, should not be the first suggestion unless it's clear that breastfeeding is not possible. Stopping breastfeeding temporarily, option D, is not ideal for mother who wishes to continue breastfeeding and should only be considered in extreme cases. Question 10. Sarah, a 32-year-old mother, is breastfeeding her 3-week-old baby. She is experiencing mild pain and discomfort in her breasts, and upon examination, you notice that one breast is slightly engorged. Sarah mentions that she has been nursing every 3 hours, but the pain seems to worsen as the day goes on. What should be your primary recommendation to help alleviate Sarah's discomfort and prevent further complications? A. Advise Sarah to reduce the frequency of feedings to allow the breast to heal. B. Suggest that Sarah apply warm compresses before feeding and express little milk if necessary. C. Recommend that Sarah stop breastfeeding from the affected breast for a few days to allow it to rest. D. Suggest that Sarah begin using breast pump immediately after each feeding to prevent milk buildup. Answer. B. Suggest that Sarah apply warm compresses before feeding and express a little milk if necessary. Explanation. Engorgement occurs when the breasts become overly full with milk, often leading to pain and discomfort. To help alleviate this, applying warm compresses before breastfeeding can help soften the breast tissue and make the milk flow more easily. If the engorged breast is too firm, Sarah may need to express a small amount of milk to soften it before breastfeeding. Reducing the frequency of feedings, option A, is not advisable as it can worsen the situation. Stopping breastfeeding from the affected breast, option C, can lead to further engorgement. Using a pump, option D, should only be recommended if Sarah cannot nurse directly from the breast, as pumping excessively can lead to overproduction of milk. Question 11. Lydia, a 6-week-old infant, has been exclusively breastfed since birth. Her mother, Jenny, is concerned that Lydia is not gaining weight as expected. Although Lydia is breastfeeding frequently, Jenny notices that her baby seems fussy and frequently falls asleep during feedings. Upon examination, Lydia's latch appears shallow, and Jenny mentions that her nipples feel sore after nursing. What would be your most appropriate course of action to support Jenny and Lydia? They advise Jenny to continue nursing frequently and wait a few more weeks for the situation to improve. B. Recommend that Jenny begin pumping and bottle feeding to monitor milk intake. C. Suggest that Jenny seek lactation consultation to assess and correct Lydia's latch and feeding technique. D. Recommend that Jenny start supplementing with formula to ensure Lydia's nutritional needs are met. Answer. C. Suggest that Jenny seek a lactation consultation to assess and correct Lydia's latch and feeding technique. Explanation. Shallow latch can significantly impact the effectiveness of breastfeeding, leading to poor milk transfer, nipple soreness, and inadequate weight gain. The first step should be to consult with lactation specialist who can evaluate Lydia's latch and Jenny's technique, providing guidance on positioning and latch correction. Waiting few more. Option A could delay addressing the issue and may lead to continued feeding difficulties. Pumping and bottle feeding, option B, is not the best first step unless necessary, as it can introduce bottle preference and create more feeding issues. Supplementing with formula, option D, should be considered only after assessing the underlying problem with breastfeeding. Question 12. Emily, a 4-month-old baby, has been exclusively breastfed since birth. Her mother, Caroline, has returned to work and is now attempting to pump and store milk for daycare. However, she has noticed that her milk output has decreased significantly since she started pumping. Caroline is concerned that her milk supply is dwindling and that Emily will not get enough milk while she is at work. What should Caroline do to help maintain her milk supply while working? A. Increase the frequency of her pumping sessions to mimic Emily's usual feeding schedule. B. Reduce the number of pumping sessions and focus on direct breastfeeding in the evening. C. Start taking herbal supplements to boost milk production. D. Supplement with formula during the day and focus on breastfeeding during evenings and weekends. Answer A. Increase the frequency of her pumping sessions to mimic Emily's usual feeding schedule. Explanation. To maintain an adequate milk supply while working, Caroline should pump as frequently as Emily would typically feed during the day. This will help stimulate milk production and prevent decrease in supply. Reducing pumping sessions, option B, could actually contribute to drop in supply, while some herbal supplements may help some mothers, option C, should be used cautiously and are not primary solution. Supplementing with formula, option D, is not recommended unless it becomes necessary, as it may reduce the baby's demand for breast milk, potentially leading to further decline in supply. Question 13. Rebecca, a 2-month-old infant, has been breastfeeding successfully but recently developed green mucus-like stools and excessive gas. Rebecca's mother, Naomi, is concerned about the change in stool appearance and wonders if it could be a sign of food allergy. Naomi has been eating dairy products regularly and wonders if that could be affecting Rebecca. What is the most appropriate recommendation for Naomi to address this issue? A. Suggests that Naomi eliminate dairy from her diet for a few weeks to see if Rebecca's symptoms improve. B. Advise Naomi to switch to formula feeding immediately to avoid any potential allergic reactions. C. Recommend that Naomi increase the frequency of breastfeeding to dilute any potential allergens in her milk. D. Suggest that Naomi try introducing solid foods to Rebecca to help with her digestion. And so A suggests that Naomi eliminate dairy from her diet for a few weeks to see if Rebecca's symptoms improve. Explanation: green mucus-like stools and excessive gas could be signs of sensitivity or allergy to dairy proteins in Naomi's milk. Eliminating dairy from Naomi's diet for a few weeks allows time to observe whether the symptoms improve, as this is often the first step in managing dairy sensitivities in breastfeeding infants. Switch formula option B is unnecessary unless the symptoms are severe or do not improve with dietary changes. Increasing breastfeeding option C would not address the underlying issue. Introducing solid foods option D is not appropriate for 2-month-old baby and would not resolve the issue. Question 14. Grace, a 3-week-old infant, has been breastfeeding well but recently started showing signs of frequent spitting up after feedings. Her mother, Rachel, is concerned that Grace might be overfeeding or having trouble with digestion. What should Rachel do to address her concerns about Grace's spitting up? A. Suggest that Rachel reduce the frequency of feedings to prevent overfeeding. B. Recommend that Rachel try holding Grace in more upright position during and after feedings to reduce spitting up. C. Advise Rachel to switch to formula feeding to reduce the risk of spitting up. D. Suggest that Rachel stop breastfeeding temporarily to allow Grace's digestive system to settle. Answer: B. Recommend that Rachel try holding Grace in a more upright position during and after feedings to reduce spitting up. Explanation: frequent spitting up in infants is often normal, particularly in the first few months of life, and is typically due to an immature digestive system. Holding Grace in an upright position during and after feedings can help reduce the likelihood of spitting up by allowing gravity to help keep milk in the stomach. Feeding frequency option A is not necessary unless the baby is consistently overfed, and formula feeding option C is not recommended unless there is a clear reason to switch. Temporarily stopping breastfeeding option D is unnecessary, as breastfeeding provides optimal nutrition for infants. Question 15. Megan, a 5-month-old baby, has been exclusively breastfed. Her mother, Elizabeth, has been noticing that Megan seems distracted during breastfeeding sessions, pulling away from the breast and appearing uninterested. Elizabeth is concerned that Megan might be weaning prematurely or that there is a problem with the milk supply. What is the most appropriate advice to address Elizabeth's concerns? A. Suggest that Elizabeth try using bottle to see if Megan will feed more easily. B. Recommend that Elizabeth offer more frequent breastfeeding sessions to keep Megan engaged. C. Advise Elizabeth to wait a few weeks for Megan to snap out of this phase and not worry about it. D. Suggest that Elizabeth continue offering the breast when Megan is hungry, but also introduce solid foods as supplement. Answer: B. Recommend that Elizabeth offer more frequent breastfeeding sessions to keep Megan engaged. Explanation: at 5 months, it is common for babies to become distracted during breastfeeding, particularly if they are more alert and interested in the environment. Offering more frequent feedings and ensuring a calm, quiet environment can help keep Megan engaged during breastfeeding. Switching to a bottle option A is not recommended at this stage, as it may disrupt breastfeeding habits. Waiting without intervention option C could cause frustration for both mother and baby. Introducing solid foods option D should be done gradually, starting at around 6 months, but it is not a solution to the current breastfeeding issue. Question 16. Samantha, a 4-week-old infant, is breastfeeding successfully but seems to be having trouble with colic, often crying for several hours in the evening. Her mother, Linda, is considering eliminating certain foods from her diet, thinking that they might be contributing to the colic. What should be your primary recommendation for managing colic in this infant? A. Recommend that Linda start an elimination diet, removing common allergens such as dairy and gluten. B. Suggest that Linda try soothing techniques, such as swaddling or rocking, to calm Samantha during crying episodes. C. Advise Linda to reduce the frequency of breastfeeding sessions to prevent overstimulation. D. Recommend that Linda switch to formula feeding to reduce any possible irritation from breast milk. Answer: B. Suggest that Linda try soothing techniques such as swaddling or rocking to calm Samantha during crying episodes. Explanation: colic is common in the early weeks of life and typically resolves by 3-4 months. In most cases, it is not related to the mother's diet. While some mothers may choose to try an elimination diet, option A, this is not typically necessary unless there are clear signs of food allergy. The most effective approach: try soothing techniques such as swaddling, rocking, or using white noise to comfort the baby during crying episodes. Reducing breastfeeding frequency, option C, is not effective for colic and can impact milk supply. Switching to formula, option D, is also not necessary unless there are specific medical concerns. Question 17. Lily, a 7-month-old baby, is showing signs of readiness for solid foods. Her mother, Susan, wants to start introducing solids, but she is unsure about the best approach. What is the most appropriate guidance for Susan as she begins introducing solid foods to Lily? I suggest that Susan introduce pureed vegetables and fruits first, avoiding grains and meats. B. Recommend that Susan begin with rice cereal mixed with breast milk or formula. C. Advise Susan to wait until Lily is 12 months old to start solid foods, as the risk of allergies is lower. D. Encourage Susan to offer a variety of foods, including vegetables, fruits, and meats, while continuing breastfeeding as the primary source of nutrition. Answer: D. Encourage Susan to offer a variety of foods, including vegetables, fruits, and meats, while continuing breastfeeding as the primary source of nutrition. Explanation: at 7 months, babies are typically ready for solids. The best approach is to introduce a variety of foods, starting with single-ingredient purees and gradually offering new flavors and textures. It's important that breastfeeding continues as the primary source of nutrition until at least 12 months. Pureed vegetables and fruits, option A, a good start, but offering meats and grains is also important. Starting with rice cereal, option B, is fine, but is not the only food to introduce. Waiting until 12 months, option C, is not recommended, as early solid food introduction helps babies develop eating skills. Question 18. Kathy, a 6-week-old baby, is showing signs of reflux, such as spitting up frequently and being fussy after feedings. Her mother, Deborah, is concerned about the possibility of gastroesophageal reflux disease (GERD). What should Deborah do to address Kathy's symptoms and help her baby feel more comfortable? A. Advise Deborah to elevate Kathy's head while sleeping to reduce reflux episodes. B. Recommend that Deborah switch to formula feeding to ease the reflux symptoms. C. Suggest that Deborah feed Kathy smaller amounts more frequently to avoid overloading the stomach. D. Advise Deborah to stop breastfeeding and exclusively pump to monitor milk intake. Answer: C. Suggest that Deborah feed Kathy smaller amounts more frequently to avoid overloading the stomach. Explanation: for babies with reflux, feeding smaller amounts more frequently helps avoid overloading the stomach, which can trigger reflux. Elevating the head, option A, is not always effective and could pose safety concerns. Switching to formula, option B, is not necessary unless there is a medical reason. Pumping and monitoring milk intake, option D, is not the first step for addressing reflux, as it is typically manageable with adjustments to feeding routines and positioning. Question 19. Jessica, a 6-week-old baby, has been exclusively breastfed but has recently started displaying signs of fussiness after feedings, especially in the evenings. Her mother, Sarah, is concerned that Jessica may not be getting enough milk during feedings, as she seems unsatisfied and often continues to cry. Sarah has been feeding Jessica every 3-4 hours during the day, but her baby often falls asleep at the breast and seems to tire quickly. What advice would you give Sarah to ensure that Jessica is feeding effectively? Advise Sarah to extend the time between feedings to ensure that Jessica is hungry enough to latch and feed for longer. B. Suggest that Sarah try switching to formula to ensure that Jessica is getting enough nutrition. C. Recommend that Sarah try breast compressions during feedings to encourage more milk flow and help Jessica stay engaged. D. Recommend that Sarah feed Jessica less frequently during the day and provide a longer gap between feedings. Night to encourage more rest. Answer: C. Recommend that Sarah try breast compressions during feedings to encourage more milk flow and help Jessica stay engaged. Explanation: fussiness after feedings can be a sign that Jessica is not getting enough milk, often due to ineffective latch or low milk flow. Breast compressions help to increase milk flow and encourage the baby to stay engaged during the feed. Extending the time between feedings, option A, may lead to overfeeding or milk production. Switching to formula, option B, is not necessary unless there is a medical reason to do so. Reducing feeding frequency, option D, is not advisable when the baby is already showing signs of hunger or unsatisfied feeding. Question 20. Maria, a first-time mother, is exclusively breastfeeding her 2-month-old daughter, Emma. She has been feeling exhausted and is struggling to balance breastfeeding with her daily responsibilities. She has heard about the benefits of pumping to provide expressed milk for others to feed Emma, but she is unsure about the right time to start pumping. When should Maria consider introducing pumping into her routine, and what are the key considerations? A. Maria should start pumping immediately after every breastfeeding session to increase milk supply. B. Maria should wait until Emma is 3-4 months old before introducing pumping to avoid disrupting breastfeeding. C. Maria can start pumping at any time, even in the early weeks, to provide milk for others and to ease her own feeding routine. D. Maria should wait until Emma is exclusively on solids before introducing pumping into her routine. Answer: B. Maria should wait until Emma is 3-4 months old before introducing pumping to avoid disrupting breastfeeding. Explanation: introducing pumping too early, especially in the first few weeks, can lead to nipple confusion and potentially disrupt breastfeeding, as the baby may develop a preference for the bottle. It's generally recommended to wait until breastfeeding is well established, which is around 3-4 months, before introducing pumping. Immediately after every feeding, option A, could lead to overproduction and stress for the mother. Waiting until the baby is on solids, option D, is unnecessary, as solids are introduced around 6 months, while pumping can begin earlier with proper guidance. Question 21. Samantha, a 3-month-old baby, is thriving on breast milk alone but has been experiencing some difficulty with constipation. Her mother, Clara, is concerned that her baby is not passing stools regularly and is becoming uncomfortable. Clara is wondering if the constipation could be related to the breast milk, as she has heard that some breastfed babies can have difficulty with digestion. What would be your primary recommendation for Clara? Addressing Samantha's constipation, A. Recommend that Clara introduce water or fruit juice to Samantha's diet to help relieve constipation. B. Suggest that Clara stop breastfeeding and switch to formula feeding to see if the constipation improves. C. Advise Clara to offer more frequent feedings to help stimulate Samantha's digestive system. D. Recommend that Clara try introducing solid foods immediately to help with Samantha's digestion. Answer: C. Advise Clara to offer more frequent feedings to help stimulate Samantha's digestive system. Explanation: breastfed babies often experience less constipation than formula-fed babies, and in many cases, infrequent stools are a normal part of their development. Increasing the frequency of feedings, option C, can help stimulate the digestive system, as breast milk is highly digestible. Introducing water or fruit juice, option A, is generally not recommended for babies under 6 months. Switching to formula, option B, is not necessary unless there is medical reason to do so. Introducing solid foods, option D, is typically not recommended before 6 months, as babies may not be developmentally ready. Question 22. Rachel, a mother of a 4-month-old baby, has been exclusively breastfeeding but is considering introducing formula to ensure that her baby receives enough nutrition, as she feels that her milk supply is dwindling. Rachel is worried that formula feeding may affect the bond between her and her baby. What would be your advice to Rachel regarding the introduction of formula? A. Advise Rachel to switch to formula feeding completely, as it will help her baby get more balanced nutrition. B. Suggests that Rachel continue breastfeeding while introducing formula to supplement her milk supply if necessary. C. Recommend that Rachel stop breastfeeding immediately and begin formula feeding exclusively to eliminate any stress. D. Suggests that Rachel avoid formula feeding altogether, as breast milk is always the best option for her baby's nutrition. Answer: B. Suggests that Rachel continue breastfeeding while introducing formula to supplement her milk supply if necessary. Explanation: many mothers who feel their milk supply is decreasing may benefit from supplementing with formula while continuing to breastfeed. This way, Rachel can ensure her baby is getting enough nutrition while still fostering the bond that breastfeeding provides. Switching to formula completely, option A, is not necessary. There are significant issues with breastfeeding. Stopping breastfeeding abruptly, option C, may not be necessary and could affect milk supply further. Avoiding formula altogether, option D, might not be practical if Rachel is concerned about her milk supply. Question 23. Jessica, a 3-week-old baby, is showing signs of jaundice, including yellowing of her skin and eyes. Her mother, Hannah, is breastfeeding but has expressed concern that her baby may not be getting enough milk, contributing to the jaundice. What steps should Hannah take to address this situation and help reduce the effects of jaundice? A. Recommend that Hannah reduce the frequency of breastfeeding to give Jessica's liver time to process the bilirubin. B. Suggest that Hannah increase the frequency of feedings to ensure that Jessica is getting enough milk to help clear the bilirubin from her system. C. Advise the Hannah stop breastfeeding and switch to formula feeding, as formula is more effective in reducing jaundice. D. Recommend that the Hannah try sunlight exposure to help clear the jaw without adjusting breastfeeding frequency. Answer. B. Suggests that Hannah increase the frequency of feedings to ensure that Jessica is getting enough milk to help clear the bilirubin from her system. Explanation. Jaundice in newborns is often caused by an excess of bilirubin, and frequent feedings can help promote stooling, which in turn helps eliminate bilirubin from the baby's system. Increasing the frequency of breastfeeding, option B, ensures that Jessica is getting enough milk and help hydration and digestion, both of which can reduce the severity of jaundice. Reducing feedings, option A, would not help clear bilirubin. Switching to formula, option C, is not necessary unless directed by a healthcare provider. Sunlight exposure, option D, can help, but it is best combined with increased feeding to ensure proper milk intake. Question 24. Lena, a 6-month-old baby, has started to show interest in solid foods and is ready to begin transitioning from breast milk to more varied nutrition. Her mother, Lily, is seeking advice on how to begin this transition. What would be your primary recommendation for introducing solid foods to Lena? A. Suggest that Lily start with pureed fruits and vegetables to introduce Lena to new flavors and textures. B. Recommend that Lily begin with cereal mixed with breast milk to ensure Lena gets a balanced introduction to solids. C. Advise Lily to introduce solid foods while continuing to breastfeed as the primary source of nutrition. D. Suggest that Lily delay the introduction of solid foods for a few more months to ensure Lena is ready. Answer. C. Advise Lily to introduce solid foods while continuing to breastfeed as the primary source of nutrition. Explanation. At 6 months, babies are typically ready to begin solid foods, but breast milk should remain their primary source of nutrition until at least 12 months. The introduction of solids should include single-ingredient purees, and a variety of foods can be introduced gradually. Breastfeeding should continue alongside foods to ensure balanced nutrition. Starting with cereal, option B, is acceptable, but purees of fruits and vegetables, option A, are also excellent first foods. Delaying solids, option D, beyond 6 months could delay developmental milestones related to eating. Question 25. Lena, a 2-month-old baby, has been feeding well but has started to show signs of discomfort such as excessive crying and arching her back during and after feedings. Her mother, Maria, suspects that Lena may be experiencing acid reflux. What is the most appropriate recommendation to help Lena with her symptoms? A. Recommend that Maria stop breastfeeding and start formula feeding to reduce the risk of reflux. B. Suggest that Maria try holding Lena upright during and after feedings to help reduce reflux episodes. C. Advise Maria to feed Lena in a lying-down position to reduce the discomfort associated with reflux. D. Suggest that Maria feed Lena more frequently in smaller amounts to avoid reflux. Answer. B. Suggest that Maria try holding Lena upright during and after feedings to help reduce reflux episodes. Explanation. Acid reflux in infants can cause discomfort and crying, but one of the most effective ways to manage it is by ensuring that the baby is held upright during and after feedings. This helps prevent milk from flowing back into the esophagus, reducing reflux symptoms. Stopping breastfeeding, option A, is not necessary for men. Reflux, as breast milk is generally easier to digest than formula. Feeding in a lying down position, option C, would likely worsen reflux. Feeding more frequently in smaller amounts, option D, can help some babies, but keeping them upright is key to reducing reflux episodes. Question 26. Sarah is concerned about her 4-month-old baby's growth and development. Despite breastfeeding exclusively, her baby seems to be gaining weight slowly, and Sarah is worried that she may not be producing enough milk. What steps should Sarah take to address her concerns about her baby's growth while continuing to breastfeed? A. Recommend that Sarah begin supplementing with formula to ensure that her baby is gaining weight properly. B. Suggest that Sarah track the number of wet diapers and bowel movements to ensure that her baby is feeding enough. C. Advise Sarah to reduce breastfeeding sessions to increase milk production. D. Recommend that Sarah stop breastfeeding and transition to exclusive formula feeding. Answer. B. Suggests that Sarah track the number of wet diapers and bowel movements to ensure that her baby is feeding enough. Explanation. Monitoring the baby's wet diapers and bowel movements is a helpful way to assess whether the baby is getting enough milk. As long as the baby is producing enough wet diapers, around 6-8 per day, and having regular bowel movements, it is a good sign that they are feeding adequately while supplementing with formula. Option A. An option for some, it is generally not recommended unless there is clear evidence of insufficient milk supply. Reducing breastfeeding sessions. Option C would not help increase milk production, and transitioning to formula. Option D is unnecessary unless there are medical concerns that require it. Question 27. Elena, a 5-month-old baby, has recently developed a nipple preference and is now refusing to latch on one side of her mother's breast. Her mother, Alice, is concerned that this could affect her milk supply. What strategies can Alice use to encourage Elena to latch on both sides again and avoid potential breastfeeding issues? A. Advise Alice to stop offering the preferred side and focus only on the non-preferred side to encourage Elena to latch on both sides. B. Suggest that Alice offer the non-preferred side first while Elena is the most hungry to encourage her to latch. C. Recommend that Alice exclusively breastfeed on the preferred side to avoid frustrating Elena. D. Recommend introducing bottle or pacifier to encourage Elena to latch on the non-preferred side. Answer B. Suggests that Alice offer the non-preferred side first while Elena is the most hungry to encourage her to latch. Explanation. When a baby develops a nipple preference, offering the non-preferred side first when the baby is most hungry is an effective strategy to encourage them to latch. This allows the baby to receive milk when they are most eager and they may be more willing to latch. Exclusively breastfeeding on one side. Option C could result imbalanced milk supply and may not resolve the nipple preference. Introducing a bottle or pacifier. Option D could exacerbate the preference and complicate breastfeeding. Avoiding offering the preferred side. Option A could increase frustration and worsen the situation. Question 28. Olivia, a first-time mother, has been breastfeeding her 2-week-old baby, Ethan, but has started to experience sore and cracked nipples. She is concerned that the pain could interfere with her breastfeeding efforts. What advice would you give Olivia to help manage and prevent further nipple damage while continuing to breastfeed? A. Recommend that Olivia switch to formula feeding to reduce nipple discomfort. B. Suggest that Olivia use nipple shields while breastfeeding to prevent further irritation. C. Advise Olivia to continue breastfeeding frequently and apply lanolin cream after feedings to promote healing. D. Recommend that Olivia stop breastfeeding completely until her nipples have healed. Answer C. Advise Olivia to continue breastfeeding frequently and apply lanolin cream after feedings to promote healing. Explanation. Sore and cracked nipples are a common issue for new mothers, but can often be managed with proper breastfeeding techniques and nipple care. Continuing to breastfeed frequently. Option C is important to maintain milk supply, and applying lanolin cream can help soothe and heal cracked nipples. Nipple shields. Option B sometimes be helpful, but they should be used under guidance, as improper use can lead to further complications. Stopping breastfeeding. Option D is generally not necessary and may impact milk supply. Switching to formula. Option A would not address the root cause of the nipple discomfort. Question 29. Carla is returning to work after a 3-month maternity leave and is planning to continue breastfeeding. She is concerned about how she will manage breastfeeding and expressing milk while at work. What strategies can Carla use to successfully continue breastfeeding while also expressing milk for her baby's care during the workday? A. Carla should exclusively breastfeed at home and pump during work hours to ensure her milk supply is maintained. B. Carla can breastfeed as often as possible when at home and pump once during work hours to create milk stash. C. Carla should stop breastfeeding at home and only pump during work hours to provide milk for her baby. D. Carla can pump only in the morning and skip pumping during work hours, as the milk supply will naturally. Answer. B. Carla can breastfeed as often as possible when at home and pump once during work hours to create a milk stash. Explanation. The key to continuing breastfeeding while working is maintaining regular milk expression. Breastfeeding as often as possible when at home. Option B helps maintain milk supply while pumping during work hours, typically 2-3 times per workday. Helps create a stash of expressed milk for the baby's care. Breastfeeding at home and pumping during work. Option A is a good approach, but may require more effort than necessary if only one pumping session is needed during the workday. Stopping breastfeeding at home. Option C is unnecessary and could harm milk supply. Skipping pumping sessions. Option D is not advisable, as it can result in reduced milk supply. Question 30. Rachel is having trouble with her 3-month-old baby, Samuel, frequently biting her while breastfeeding. She finds it painful and is unsure why Samuel is doing this. What are the potential reasons for Samuel's biting during breastfeeding, and what solutions can Rachel try to resolve the issue? A. Samuel may be teething, and Rachel should stop breastfeeding until the teething process is over. B. Samuel may be pulling away from the breast too soon, and Rachel should ensure that he finishes feeding before removing him from the breast. C. Samuel is likely bored with breastfeeding and would prefer bottle feeding. Rachel should introduce bottle to resolve the issue. D. Samuel's biting may be a sign of poor latch, and Rachel should work on improving his technique. Answer: B. Samuel may be pulling away from the breast too soon, and Rachel should ensure that he finishes feeding before removing him from the breast. Explanation: biting during breastfeeding is common when babies are teething, but it can also occur if the baby is pulling away from the breast before finishing the feed. Option B. Ensuring that Samuel feeds until he is finished will help prevent him from biting. Stopping breastfeeding due to teething. Option A. Unnecessary, as there are ways to manage teething discomfort while breastfeeding. Introducing a bottle. Option C. May not solve the problem, as it is more likely related to feeding behavior. A poor latch. Option D. It can cause discomfort, but biting is more typically a sign of pulling away or teething.